Hi, my name is Mia, and this is my presentation on Alprazolam. Alprazolam, also known as Xanax, is a prescription drug commonly used to treat anxiety disorders and panic disorders. It enhances the endogenous neurotransmitter GABA, which has a calming effect on our central nervous system. It is a part of the benzodiazepine class of psychoactive drugs, which are depressants, and is made synthetically in a lab. Alprazolam has many different effects. However, the type of effect I'll be focusing on are its sedation properties. It's a Schedule IV drug, meaning it has an accepted legal medical use. It has low potential for physical and psychological dependence, and thus low risk for addiction. However, there have been cases where people have abused alprazolam and gotten addicted to it. Alprazolam is primarily administered orally in the form of tablet pills. It gets absorbed in the gastrointestinal tract and has a rapid absorption rate with peak concentrations after 1 to 2 hours. Whether the tablet is immediate or extended release will affect the absorption rate. It also has high bioavailability, so the majority of the drug is absorbed into the bloodstream, and currently there's no evidence that depot binding affects bioavailability. It binds to serum proteins, specifically albumin found in the blood plasma. It's also lipid soluble, so it can easily cross the blood-brain barrier to spread throughout your body. Alprazolam is metabolized by cytochrome 3A4 enzyme in the liver, and liver impairment and co-administration with other drugs can affect the functioning of this enzyme. For example, co-administration with the selective serotonin reuptake inhibitor fluvoxamine was found to double the maximum concentration and increase half-life by 71%. It gets eliminated via first-order kinetics, so the rate of elimination is dependent on the concentration of drug in the blood. A higher concentration will equal a faster clearance. The average half-life is 11 hours, and it is excreted in our urine. Alprazolam works by binding to a specific allosteric site on the GABA A receptor. So rather than an agonist or antagonist, alprazolam is a positive allosteric modulator. This means that it does not directly activate GABA, but it makes its inhibitory effect stronger whenever it is active. So when alprazolam is allosterically bound to the GABA A receptor and GABA comes along and binds, the natural inhibitory effects of GABA are going to be increased by the presence of alprazolam. When GABA is active, alprazolam enhances its inhibitory effects on the ventral tegmental area and limbic system, decreasing the amount of interneurons firing, which are the neurons that regulate dopamine release. This ultimately causes dopamine to accumulate in the extracellular matrix and create those feelings of euphoria associated with Xanax, as well as its sedative properties. Like I mentioned before, alprazolam's main effect is its sedation properties. Since it's a depressant, it's going to suppress our central nervous system's functioning. This will look like an overall decrease in physical activity and a calmer state of mind in the person. By enhancing GABA, it triggers an influx of chloride ions that hyperpolarizes the cell, which then relaxes your muscles, decreases coordination, slows movement. It also creates disinhibition by reducing your inhibitory control, making the person more prone to impulsivity. It reduces anxiety by GABA inhibiting our limbic system, which regulates stress and fear responses. And through the hyperpolarization of the hippocampus, a part of the limbic system, alprazolam reduces our ability to encode new memories as well. Chronic alprazolam use can lead to a desensitization of the drug and thus a downregulation of GABA A receptors, making alprazolam less likely to have an effect. Withdrawal symptoms can also occur if you stop taking the drug abruptly. This is due to its short half-life, and the sudden change in central nervous system activity can create anxiety. This contributes to alprazolam's abuse potential as well, as a person may want to keep taking the drug to alleviate those adverse symptoms. Thank you for watching.